Hi folks, this is Dr. Michael Hirsh, the Medical Director for the Division of Public Health and the Chief Pandemic Information Officer for the City of Worcester. And I was asked to do a little session on Masks 101. I know people are very tired of masks, but they've really been doing a great job. If you remember that first year of the pandemic where all we had were the 3 W's, washing our hands, watching our distance, wearing our mask, we really helped to keep the pandemic from going nuts. That's when we had the Alpha variant. So come last summer in 2021, it looked like Alpha had burnt itself out. Sure enough, Delta came, and we were the first city in the Commonwealth to reinstitute the mask mandate in October. And I really do feel like, as far as the Delta surge went, that we had success in tamping down the number of cases. But then came Omicron, and starting around the second week of December, going right into where we are today, Omicron has been king, very transmissible, and you've probably heard the news that those cloth masks that you have been using, and very effectively, and actually there were whole civic groups that were creating beautiful cloth masks, and the surgical masks that we were using are no longer thought to be as effective as they need to be against Omicron. So that's why I'm wearing an N95 mask today. I'm just going to take it down so I can talk to you a little bit easier. But basically, the N95 has much tighter connections around your nostrils, around the sides of your mouth, so that the odds of something leaking in or leaking out from your breath or from other folks that are talking to you is much lower. And we'll show you some pictures of how the standard surgical mask is called 3-ply. It has 3 layers of protection. This mask has either 4 or 5, depending on where you've gotten it. Now, the N95s are going to be made much more available, and as soon as you find out about where to get it, and they're going to be distributed at most of the major drugstore chains, and we're going to have some available through the Department of Public Health, through Worcester Together, get yours. You can wear them for more than 1 day at a time. In the hospital setting, we have to change them because we're so exposed to COVID positive patients. But if you wear one of these in a day, and if you're really clever, you could put a surgical mask over it so that if there are spills or sprays or someone coughs at you, you don't get it dirty in the front. You can just stick this one in a paper bag overnight, and it will be fine in a couple of days. So you need to have really 2 of them to rotate. And that's why I think the federal government is going to give us each 3, which will be just perfect, because you'll be able to do that rotation and keep your mask going much longer. After a couple of weeks, they do kind of degrade, but I keep them going until these straps, which are really elastic and very adaptable to any shaped head, any size head, start to wear down. That's how I know that it's been on too long. And the reason we're doing this still, why are we still worried about masks? Well, we know that Omicron is so adaptable at getting into your airways and nostrils that even if you are vaccinated, you can develop a viral load that will give you what we call a breakthrough case. And right now, in many of the hospitals around the country, there are just as many vaccinated people as unvaccinated people that are getting admitted with Omicron. They're not going to the ICU. If you're vaccinated with a booster, you're not going to the ICU, you're not going to the morgue. You're getting admitted with symptoms, and you may need hospital inpatient care, but it's much less severe a case than if you were unvaccinated. So I don't want you to feel like, well, why did I bother to get vaccinated? You need to be vaccinated and you need to be boosterized. You have a 3 to 5 times more chance of being admitted if you're not boosterized, and you have a 13 times more chance of dying if you're not vaccinated. So you've got to get those needles in arms. But in the meantime, try to get your N95, wear it with pride, because it's going to help you, it's going to help your family, going to help your neighbors, going to help our town, and we're going to get through this. the Omicron numbers are coming down, but they're still way too high. Our positivity rate is still in the 20s. Got to get lower. Once we get lower, we're going to have an awesome spring. So thanks for listening. And if you have any questions, please feel free to contact us through our www.worcesterma.gov information hotline.